If you're over 60 and you haven't ejaculated in the past week, you need to hear what I'm about to tell you, because this could genuinely change how you think about your long-term prostate health. Hello, gentlemen. I'm Dr. Elena Hart, a urologist with over a decade of clinical experience working with men over 50, and today I'm sharing research that was tracked by Harvard Medical School over 18 years, involving nearly 32,000 men, and the findings are far more important than most people realize. Men who ejaculated 21 or more times per month showed a 31% lower risk of developing prostate cancer compared to men who only ejaculated 4 to 7 times monthly, and that reduction didn't come from medication, surgery, or supplements, but from a completely natural biological function your body is already designed to perform. An Australian long-term study reinforced this, showing that men averaging about 4.6 to 7 ejaculations per week were up to 36% less likely to develop prostate cancer before age 70 compared to men who did it less than 2.3 times weekly, and the protective effect was strongest in men who maintained consistency across decades of life, not just in short periods. Now, before we go further, make sure you hit the like button, comment your age below, and subscribe so you don't miss critical health insights designed specifically for men over 50. Now, let me explain why this matters so deeply. Your prostate is not just a gland. It's a living organ that produces fluid for semen every single day, and when that fluid is regularly released, your body maintains a healthy biological cycle. But when it's held for too long, secretions can stagnate, inflammatory compounds can build up, and biological waste products may accumulate inside the gland. Researchers describe this as the prostate stagnation hypothesis, and it suggests that regular ejaculation acts like a natural flushing mechanism, reducing buildup and maintaining healthier cellular conditions inside the prostate. Think of it like a drainage system. When flow is consistent, everything stays clean, but when it's blocked or inactive, pressure and buildup increase. Ejaculation improves blood circulation to the prostate, delivering oxygen and nutrients while removing waste, and this ongoing process supports tissue health, reduces inflammation, and may even help limit the formation of harmful microscopic calcifications that have been linked to prostate issues. The largest and most respected study on this topic, the Harvard Health Professionals Follow-Up Study, followed 31,925 men for nearly 2 decades and found that those who ejaculated 21 or more times monthly had a significantly reduced risk of prostate cancer across multiple age brackets, with risk reductions of 19% in younger adulthood, 22% in midlife, and up to 31% in later adulthood when frequency was maintained consistently. This is not a small statistical trend, it is a clinically meaningful difference in long-term health outcomes. Importantly, the benefit applies whether ejaculation comes from sexual activity, masturbation, or nocturnal emissions. The key factor is the biological release itself. An additional Australian study supported these findings, showing similar protective patterns with even stronger reductions in some groups, reinforcing that frequency across the lifespan matters more than occasional activity. Now, here is what most men don't realize. The protective benefit appears to peak around 21 ejaculations per month, roughly 5 times per week, and increasing far beyond that does not significantly improve protection. Balance, not excess, is what your body responds to best. But what happens if you stop? When ejaculation becomes infrequent or absent, prostate secretions can accumulate, circulation to the gland may decrease, inflammation can increase, and over time, these biological changes may create conditions that are less favorable for prostate health. The prostate, like any organ, functions best when it is regularly active, not stagnant. I've seen patients who stopped completely after losing a partner or due to misconceptions about aging, and over time, some experienced changes in PSA levels, urinary discomfort, or reduced prostate function that improved when healthy sexual activity was reintroduced in appropriate ways. One patient in his late 60s once told me he thought abstinence was healthier with age, but after reviewing the research, he gradually resumed regular activity and later told me he felt physically more balanced, slept better, and had improved urinary comfort. Now let's be clear, this is not about pressure, performance, or comparison. It's about biological maintenance. Your prostate does not stop working with age, and neither does its need for healthy circulation and periodic function. The research consistently shows that men in their 60s, 70s, and beyond are often at the highest risk for prostate issues. At the same time, their ejaculation frequency naturally declines, which creates a gap between what the body needs and what actually happens in daily life. That gap is where risk can increase. This is why maintaining a consistent pattern of about 3 to 5 ejaculations per week in older age is associated with healthier outcomes in multiple observational studies. It is also important to understand that this is one of the very few prostate risk factors that is actually within your control. You cannot change your age, genetics, or family history, but you can influence circulation, stagnation, and frequency. That alone makes this information powerful. If you're over 60 and your frequency has dropped significantly, even small increases can still be beneficial. Moving from once a week to 3 times a week is already a meaningful shift in biological activity. And regardless of relationship status, this is not limited to partnered intimacy. Masturbation is a medically recognized, normal, and healthy way to maintain prostate function when done comfortably and without strain. Of course, like any health behavior, balance matters. Excess without recovery, discomfort, pain, or compulsive patterns are not beneficial and should be addressed professionally if they occur. But in healthy ranges, regular ejaculation supports prostate function, circulation, and overall sexual health. So here is what I want you to take away today. Prostate cancer affects roughly 1 in 8 men during their lifetime, and while many risk factors cannot be changed, ejaculation frequency is a modifiable, natural, and cost-free behavior that research shows may reduce risk by up to 30% or more when maintained consistently over time. This is not about fear. It's about awareness and control over something simple but meaningful. If this helped you understand your body better, take a moment to like this video, comment your age below, and subscribe so you can continue receiving evidence-based guidance for men's health. I'm Dr. Elena Hart, and I want you to remember this. Your body is still working for you, and even in later life, small consistent habits can have a powerful impact on your long-term health.